Hello, and welcome to the Pharmacy Times News Network. I'm Nicole Grisano, your host for our Pharmacy Week in Review. Removing barriers to the drug assistance programs and reducing private insurance medication costs may decrease cost-related non-adherence among patients with HIV infection and improve their health, Pharmacy Times reported. The CDC's morbidity and mortality report included population-based data on prescription drug cost-saving strategies among U.S. patients with HIV. The CDC analyzed cross-sectional, nationally representative surveillance data on behaviors, medical care, and clinical outcomes among adult patients with HIV. The report found a link between non-adherence due to prescription drug costs, reporting an unmet need for medications from the Ryan White AIDS Drug Assistance Program, having Medicaid coverage, and having private insurance. Furthermore, patients who were non-adherent because of cost concerns were more likely to have visited an emergency department, have been hospitalized, and not be virally suppressed. Tasty desserts and dinners may have some patients with diabetes worried for the holidays, but the latest nutrition recommendations can account for the holiday diet while also keeping choices individualized, Contemporary Clinic reported. Contemporary Clinic contributor Sarah Hunt is a licensed and board-certified family nurse practitioner. Aside from common advice like drinking less alcohol and limiting carbohydrates, Hunt suggests that patients with diabetes should avoid sugary drinks in favor of dairy products. Other suggestions include eating smaller portions. A healthy plate can include half a plate of vegetables, 1/4 of a plate of healthy protein, another quarter of whole grain starch, 1 serving of dairy, and 1 serving of fruit. Hunt writes that physical activity can increase the body's sensitivity to insulin and protect tissues from oxidative stress. Finally, making sure that patients have refilled their medications in time for the holidays is vital to avoid emergency situations. A new study has demonstrated high prevalence rates of reduced serum immunoglobulin concentrations in patients with multiple sclerosis, with or without disease-modifying treatments, Specialty Pharmacy Times reported. The retrospective analysis of 2 independent European cohorts included approximately 327 patients with multiple sclerosis, 226 from Bern, Switzerland, and Athens, Greece. According to the study, patients with multiple sclerosis were significantly more likely to have immunoglobulin G concentrations below normal limits. Researchers found no significant difference in frequencies of immunoglobulin A or immunoglobulin M concentrations under normal limits. Although the significance of the levels are unknown, researchers believe that the information is useful to monitor immunoglobulin levels, especially with anti-B cell therapies, and to consider immunoglobulin substitution when levels drop below 400 milligrams per deciliters. Pharmacists may get more questions about Eliquis if patients have seen a recent commercial for the prescription medication. In the spot called Around the Corner Food Truck, the narrator explains that in a 6-month study, almost 98% of patients didn't experience another deep vein thrombosis or pulmonary embolism when treated with Eliquis. According to the commercial, Eliquis is a prescribed medical injection that is intended to treat and help prevent deep vein thrombosis or pulmonary embolism blood clot recurrences. For more great coverage and practical information for today's pharmacist, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Nicole Grisano at the Pharmacy Times News Network.